Jai Hind, myself leading flight cadet Nitika Kulsresht from 1UP Air Squadron NCC Agra. Today I am going to make a awareness video on the topic government schemes for the betterment of tribal people and sickle cell anemia. Tribal people, also known as indigenous or native populations, are groups of people who are the original inhabitants of a particular region or country. They can be broadly categorized into several zones in India: Northeastern Tribal Zone, Central Tribal Zone, Southern Tribal Zone, Western Tribal Zone, and Island Tribal Zone, with Meghalaya having 86.15% of state's population as tribals, including major tribes like Khasis and Garos. There are various problems faced by tribals. Some of them are poverty and limited access to resources, social discrimination and marginalization, limited economic opportunities, and many more. To address these challenges, the Indian government has implemented several welfare schemes to improve the lives of tribal people. Some of them are education and skill development, Eklavya model residential schools which provides quality education to tribal children, pre-matric and post-matric scholarships, offer financial supports to scheduled tribe students for education, Adivasi Shiksha Rin Yojana, skill development programs. In terms of health and nutrition, Pradhan Mantri Jan Arogya Yojana, which provides affordable health care to tribal communities, Mission Indradhanush, which ensures full immunization for children and pregnant women in tribal areas, Nikshay Mitra Initiative supports tuberculosis patients in tribal regions with nutritional and diagnostic aid, economic development, Adivasi Mahila Sashактikaran Yojana, microcredit scheme for self-help groups, infrastructure and livelihood, Dharti Aaba Janjatiya Gram Utkarsh Abhiyan, Pradhan Mantri Adi Adarsh Gram Yojana, integrated tribal development program. There are some other initiatives too. Special central assistance to tribal subplan, which provides targeted funding for tribal development within the National Development Plan. National Scheduled Tribes Financial and Development Corporation, it also offers financial assistance for tribal peoples. It is a genetic disorder that affects hemoglobin production, causing red blood cells to become rigid, sticky, and crescent shaped. This leads to blockage in blood vessels, reduced oxygen delivery, and various complications. They are caused by a mutation in the HBB gene, which codes for the beta globin unit of hemoglobin, inherited in an autosomal recessive pattern, meaning both the parents must be carriers for a child to develop this disease. Symptoms: there are some common symptoms like pain episodes or crisis due to blocked blood vessels, fatigue from anemia, frequent infections, swelling in hands and feet, delayed growth and puberty. There are some complications too, like organ damage such as spleen, kidneys and liver, increased risk of infection, vision problems. Sickle cell anemia affects millions of people worldwide. Approximately 7.7 million people worldwide live with sickle cell disease, and in India, for approximately 1.4 million people live with sickle cell disease, and about 20% of the population in high prevalence areas carry the sickle cell trait. High prevalence states are Madhya Pradesh, Chhattisgarh, Maharashtra, Odisha, Gujarat, and Tamil Nadu. Tribal population is heavily affected by sickle cell anemia, with a prevalence of 4.05% as compared to non-tribal population with a prevalence of 0.84%. Prevention is always better than cure. Preventing sickle cell anemia involves combination of genetic counseling and prenatal testing, lifestyle modification like stay hydrated, avoid extreme temperatures, manage stress, get regular checkups, and other prevention strategies like newborn screening, family planning. Carriers of the sickle cell gene can make informed decision about family planning. Educate people about sickle cell anemia, its symptoms and its management, so they can prevent it. There are some research and developments too. Gene therapy. Researchers are exploring gene therapy as a potential cure for sickle anemia. And new medications, like researchers are developing new medications to manage symptoms and prevent complications. By taking these steps, individuals can reduce the risk of complications and improve the quality of their life. Thank you.